educating, and empowering you into action. This is Warriors Talk with your host, Lady Rochelle.
Hello, hello. Welcome to Warriors Talk with author and founder Lady Rochelle, where we move away from awareness towards action. It's Health and Wellness Monday, and our topic for today is hormones and her understanding the silent power behind women's health. We are live on Intellectual Radio. We just heard from the Drive at 5 with Roman. Keep it locked right here on Intellectual Radio and allow us to feed your brain. On the last episode of Warriors Talk, I discussed from patient to partner, making your voice heard in the exam room. You can head over to YouTube and type in Intellectual Radio and stay connected for any episodes you may have missed. The quote of the day is: a woman's hormones are like the symphony of her body. When they are in harmony, everything flows. When they are out of tune, it can create chaos. Here is your announcement for today. The National Breast Cancer Coalition will be hosting their 2025 Advocate Leadership Summit taking place in the Park Hyatt Hotel in Washington, D.C., May 3rd through the 5th for an exciting weekend of programming. On Tuesday, May 6th, we will be on Capitol Hill at 9 o'clock having a rally. And then at 10 o'clock, we will be meeting with our men and women of Congress discussing breast cancer priorities. The summit prepares advocates for them to take a meaningful seat at the table wherever breast cancer decisions are being made. The National Breast Cancer Coalition will also be hosting their Project Lead coming up July 27th through August 1st, located in La Jolla, California. There is no registration fee. The tuition is free, the course materials is free, and also they provide you with meals. The attendees are expected to cover their own travel and their own stay. However, scholarships are available, but they are limited. If you are interested in learning the science language behind the concept of breast cancer to share with your community, go to stopbreastcancer.org and tell them that Warriors Talk sent you. Keep in mind that the application deadline is April 25th. If you are tuned in on any form of social media, like the show, share the show, and invite someone else in on the show that you feel may benefit from this valuable information. We are so grateful for our sponsor on today. We have Pastor Michael Richardson with the Emmanuel Church of God in Christ, who has a special message for us.
Greetings, I am Pastor Michael Richardson.
And I am First Lady Anastasia Richardson from the Emmanuel Church of God in Christ. We're located at 3058 West Van Buren in Chicago, Illinois. We are building upon a solid foundation.
And we're inviting you to join us every Sunday morning on Facebook Live at Emmanuel Kojic at 10:15 Central Standard Time. And you can also view our videos on our YouTube channel at Emmanuel Kojic-MR. Once again, this is Pastor Michael Richardson
and First Lady Anastasia Richardson. And we're from the Emmanuel Church of God in Christ. We are building upon a solid foundation.
My special guest today is our healthy solution expert with over 20 years experience as a family physician, and she's impacting lives every single day. She is a trusted and passionate voice in women's health and wellness. Welcome back to Warriors Talk, Dr. Michelle Meeks, MD. What's up, Doc?
Hello, hello, Lady Rochelle. How are you today?
I'm good. I'm good. Excited about the conversation.
Oh, yes. This is a great topic. I say for our women, but for our men too, right? To understand the women and what we are going through. So I'm looking forward to the discussion.
Absolutely. So I wanted to jump right into the conversation because I know as women, we have a lot of questions when it comes to our hormone health, and then maybe it'll help men to understand what women go through as it relates to hormones as well. And so I just wanted to just go ahead and just ask, what exactly are hormones and why are they so important to women's health?
Yes, great question to start off with. I mean, hormones are the chemical messengers in our bodies. They affect all parts of our bodies. And when we think about hormones, we think about, the female hormones, but hormones encompass more than just, the female estrogen, progesterone hormones. It's things we have talked about and some things we don't think about. Like we've talked about cortisol, we've talked about adrenaline, we've talked about thyroid. And these are some examples of hormones that really tell our bodies what to do to maintain good balance so we feel good and we can be our best selves, right? We know hormones can affect our reproductive organs, they can affect our sleep, they can affect our mood, so many things. But it's really the chemical messengers that tell the different tissues and organs in our bodies how to do, the right thing to keep our bodies in balance.
And so my next question was going to be like, what are the different types of hormones? And you did mention quite a few of them. Estrogen.
Yes, right. So I think there's probably about 50 different types of hormones in our bodies. Some are kind of obscure that we really never talk about with really long names, but the ones we think about are estrogen, progesterone, testosterone, cortisol, insulin. We don't think about insulin as a hormone, right? But insulin is made by our pancreas. And then when it's made, it goes to other parts of the body to help our bodies utilize glucose, sugar effectively. I think what else you had? Growth hormone, right? So growth hormone helps our body's organs to get to the right level, right shape, allows children to grow and be able to have the brain grow to the right size and all of that, so that all of those things help our bodies to get to our unique selves. A lot of hormones, like growth hormones, come from the pituitary gland. We don't talk about that much. It's a really, really tiny gland in the middle of the brain, but it helps to regulate all these different hormones, like growth hormone, like our ovarian hormones, and all those things as well. It starts with the biggest, one of the most important organs, which is our brain.
Wow. So some of them I never even heard of them, and some of them are just like common language that you hear all the time. I heard about the progesterone when I was going through breast cancer because my breast cancer was triple negative, which it was negative for progesterone, estrogen, and HER2. So was my first time hearing about that particular hormone.
Yeah, I mean, estrogen and progesterone, they work in tandem. And when you talk about breast cancer, right, and we talk about what's estrogen positive and estrogen negative, right? So if a breast cancer has the estrogen receptors, which means, because we didn't talk about, when you have hormones, those hormones are the keys that unlock these certain activity in the organ, right? So if you have an estrogen positive breast tumor, estrogen can unlock certain things, and we can also use that ability to treat breast cancer. But when you're estrogen negative, ER negative, progesterone negative, it's harder to treat because we don't have the right keys to unlock that treatment. But yeah, so, and I know we think about the female estrogen progesterone hormones more related to cancers like breast cancer, ovarian cancer, uterine cancer, and menopause, right? But hormones, and thinking about hormones, is not only an older person's issue. It can also be an issue in teenagers, right? For different reasons. They can have hormonal imbalances, which can lead to irregular periods, acne, mood changes, all of that. So we think about it not just for, older women going through certain diseases or life changes, but the teenagers as well.
I guess that was my next question. Can you walk us through the key hormonal changes that women experience from puberty to menopause?
Yeah. Well, that's a very in-depth discussion, but on a superficial level, as young, if you've ever raised a young tween girl into teenage years, right? We know that as they are becoming, going through puberty, the estrogen and progesterone fluctuates, and it fluctuates at different times of the month for them. And so even before a tween and a teen girl has a menstrual cycle, their bodies are already going through fluctuations in that estrogen and progesterone. So you'll start to see some of the mood changes, um, along with, body changes as they physically start to change, right? All of that is related to more estrogen in their bodies. And I always tell my friends and parents of young teens and tweens, when they become moody, as can happen because of those changes, that to remember it's a physical change that they're going through, that it affects, how they feel emotionally, and they're going through things too. So we have to be patient with them when they're going through it. But so that's sort of the beginning stages of those changes. And then as we get older, right? So from teenage to our 20s and 30s, we notice those estrogen fluctuations and progesterone. We didn't talk about FSH and LH, which are other hormones, luteinizing hormones, follicle stimulating hormones. All of those hormones regulate our menstrual cycle. So they become a little bit more in a cycle where we kind of know when those fluctuations are going to occur, and we in our own mood stabilizes because we recognize those things. But in a lot of women, they can have still erratic fluctuations in those hormones related to something called polycystic ovarian syndrome, which can affect the natural, normal levels and cycling of those hormones when the ovaries have cysts, and that can affect how the pituitary gland releases hormones and all of that. So even as teens and as we get into our 20s and 30s, we have other reasons for those female hormone fluctuations.
One of my questions were, when girls are going through puberty, is it like hereditary if they're going through like at a certain age, or is that just all on their own makeup as to when?
There's always some genetic component to it, right? There's some genetic. We always will ask, the parents or the young adult, do they know when their parents started their cycle? Because it sometimes is around the same time, especially when we get to the other end with menopause. Unless someone had a surgical menopause by having a hysterectomy or something, we'll try to ask that woman, do you know how old your mom was when she went through menopause? Because it tends to be kind of around the same time. Not a hard and fast rule, but it can help us sort of manage someone. So yes, there is a little bit of correlation between when our daughters have the beginning of their cycles and when we did as well.
Let's talk about some of the lifestyle hormonal balance or imbalance that an individual can have as it relates to their hormones.
Yeah, so there is, as we are going through life because of stress, lack of sleep, maybe other disease states that we are dealing with, we will develop hormonal imbalance. That hormonal imbalance, we've talked a lot about, you know, cortisol and how cortisol affects your sleep and your mood and your stress, and that stress itself increases your cortisol levels, which then can affect your mood, your blood pressure, your ability to get restful sleep. And it's sort of a vicious cycle. And so too much or too little of a hormone can put us out of balance. And the thing with hormones is that it doesn't take a big shift for you to feel the difference. I can tell you, like, when we check labs, blood work for like thyroid hormone, when someone is, you know, a few tenths of a point out of balance and we sort of correct the numbers into the normal range, they'll feel so much better. You know, it doesn't take a big swift change for you to feel the difference. And that's the thing about trying to keep our hormones in balance and the things that we can do to help keep them in balance, right? So some is medications, but some is also lifestyle changes.
Are there any specific signs that women should be looking out for that may indicate that something may be off?
Yeah. So especially in the fertile years, in their 20s or 30s, right? If they're trying to conceive and have a child and they're having fertility issues, that can be a sign of hormonal imbalance, right? That might lend to some diagnostic testing that could, find hopefully a simple cause, right? Is it something going on in your uterus? Do you have fibroids, which can also be caused by hormonal changes? Is there polycystic ovaries? What's causing it? So fertility issues for sure. Irregular periods, right? Normally you should be having, a menstrual cycle, every 3 to 4 weeks. We think about 21 days is the short end, maybe up to 5 to 6 weeks could be the long end. But as long as that's your regular cycle, that's okay. But irregularities in your menstrual cycle can be a sign of hormonal issues, along with infertility. And then things like, mood, like we said, mood, sleep, obesity can lead to changes with those female hormones as well.
That was another question I had was can you being hormonal imbalance cause you to gain weight?
Yeah, so it goes both ways, right? So when you are obese, it can lead to hormonal changes, right? And there are hormonal changes that can lead to weight gain, such as your thyroid, such as your cortisol, and even for older women who are going through menopause, right? When your estrogen levels start to drop and those hormones are changing into a different level, a different new normal. A lot of women will gain weight. They'll gain weight around the tummy, things like that. So it goes both ways, that obesity can lead to some hormonal changes, lead to insulin issues, lead to polycystic ovaries, and it goes the other way. So the point is, if you're feeling, we always talk about this, if you're feeling different, if something's not right, talk to your provider. Let them, and really don't be ashamed to talk about all of it, right? If you're not sleeping well, if you're having irregular cycles, if you're really moody and anxious or depressed, all of that could be related to hormones and things that we can check to see what we need to do to help you.
So I heard something, Doc, today when I was doing my research, and it's about the PCOS. And the one that doctor was saying that the women that take the birth control to cause the cycle to come, it's a false, I guess it's a false thing, because if they stop taking it, then the period won't come. So it makes it seem like, oh, I'm having a period, so I'm ovulating, but really you're not. It's because you are taking the birth control. So, I mean, I feel like that can cause more harm than good. Why would they even prescribe the birth control?
Yeah, so the birth control is for a few reasons, right? So when someone has PCOS, polycystic ovarian syndrome, because of that imbalance, yes, they're not having regular periods, but they can also have some of those other things we talked about, right? It's not really just that we want you to have a regular period, but it's that because your hormones are out of balance, all the other things, you're not sleeping well, right? You are moody. Maybe you have some skin changes, all of those things. And so it is definitely a good medical treatment that we use to give those birth control, to put the hormones back in balance. So in general, that young lady can feel better, right? So part of it is, yes, we're trying to also regulate your cycle, but you're right. That may not lead to, that's not correcting the original cause of the polycystic ovaries, but we're going to treat the symptoms so that those hormones can be in balance and they can feel better overall.
The reason why I asked is because my daughter, that's the type 1 diabetic, the doctor diagnosed her with it, and she was having irregular periods and, the questions that led up to that. So she gave her pills. I don't think they were birth control pills, but she gave her these pills to help make the period come down. So like a couple of months, and it helped the period come down regularly. And then she just gave her like maybe it might have been a month supply. But then after that, the period started coming on its own, by itself.
Yes.
So
yes.
My point was like, okay, when these women get ready to want to have babies, of course, by them being diagnosed with PCOS, they're going to have those issues anyway. It's not impossible for them to get pregnant, but they may have some sort of issues when they try to get pregnant.
Right. Yeah. So because if someone with PCOS is not ovulating regularly, right? So ovulation, for the listeners, is when your ovary releases that egg and it goes down the tube and travels to your uterus, waiting for sperm to come and fertilize it, right? So if you're not ovulating and actually releasing an egg, you can have trouble, of course, getting pregnant. And so for people who have PCOS, if they're trying to conceive, if we have not, because as you said, on some occasions, if we give a patient birth control pills, it can kind of get them in rhythm and get their hormones doing what it needs to do naturally, and then they can have normal periods on their own, right? And that's great. But for some people, if that's not happening and they remain not ovulating normally to release an egg for sperm to come and fertilize it, then we have other options. We do other infertility medications, which can make a woman ovulate, help her ovulate. Clomid is a medication we use a lot. It can induce ovulation. So that your ovary releases an egg. The thing about people who are going through infertility, when we give that medicine, we can't predict whether your ovary will release 1 egg, 2 eggs, 3 eggs, and then you have lots of babies.
Yeah.
So, yeah.
I also, Doc, heard something about if you have a short period, like if the period lasted maybe 1 to 3 days, maybe, that it's not enough being released for you to, I guess, for that egg to be fertilized?
Yeah, because if you're really having a cycle that's about 1 to 3 days, you're probably still a little bit out of balance. And so you may or may not be releasing an egg to be fertilized. So the fact that we have a menstrual cycle is a little bit, it's separate from the actual ovary, the egg going to the uterus. And this is a deeper discussion, but when your hormones are in balance and your what we call the lining of the uterus is getting built up to get ready for that egg to come and get fertilized. But if there is no fertilization, then your body says, we don't need that nice cushion in your uterus. Release all that, and that's your period, right? So the body is preparing for fertilization every month by building up your uterine lining, making it right, cushiony, ready for an egg and a sperm to come together and implant in your uterus. But if that doesn't happen, you just release that lining, that blood, and it comes out and it waits next month. Okay, are we going to release an egg? Is there going to be sperm? If there's no fertilization, no pregnancy, we release that. So it's 2 things happening when you have a period. It's the lining of your uterus that you didn't need because we were building it up for a nice cushioning. We didn't need that. So along with that is that microscopic egg, that is released as well.
Awesome. Thank you for breaking that down for us. I wanted to the hormone testosterone because we do have some women that have a little bit more. And we know when you hear the word testosterone, you think about men. You think about, okay, that's something they should have. But we know that women do have it too. But there are some women who have it to the point to where they grow hair on their chins and they may have to shave or wax and they're just wondering like, hey, what's happening? Why do I have this, happening to me?
Yeah. So that testosterone, so women, we do have testosterone. We have it at a much lower level than men do. But on occasion, if our body is producing more testosterone or the balance of estrogen to testosterone isn't right, is too much, then we have symptoms like what we call hirsutism, growing more extra hair on your face. Sometimes you could even have a deeper voice if you have too much testosterone related to your estrogen balance. And we do have medications that we give to sort of help put that in balance. And then we also use birth control pills because, again, what we're trying to do is get the right level of both things together so that one is not really outweighing the other and giving more symptoms. And you said that related to facial hair because as women get older, you'll notice, right, the older women getting a little bit more facial hair because it's not that we got more testosterone, it's the fact that the estrogen is going down, right? As we're getting to perimenopause, menopausal, so that balance is shifted, right? So it's more testosterone related to estrogen. And that speaks to another issue, which is as women are going through menopause, I know my gynecologist said once as I was talking to her, she said, we don't have to go through menopause the way our parents went through menopause, the way our parents and our grandparents went through menopause. We know more now. And so with good education and a good discussion, hormone replacement treatment, which used to be a bad word, can be helpful for women going through menopause, depending upon your medical history, right? So hormone therapy is not for everyone. We know that. Related to your cancer risk, your cardiovascular risk for heart disease and such, it may not be right for you. But if someone is going through perimenopause, menopause, and they're thinking about it, or having hot flashes. So when we talk about menopause and the hormones, we think about just hot flashes, but there's a lot of things that women go through when they're going through the change, from sleep to moodiness to anxiety to the weight gain, irritability, hot flashes, night sweats, all of that can be managed with hormone therapy, but you have to have a good discussion with your provider to know if it's right for you.
You mentioned the hormone replacement therapy, and I think a lot of women, when they hear that, they do get nervous because we've heard that it increases your risk of breast cancer. And it's like, why would they give me this treatment if this is what it could cause?
Right. So you have to have that discussion, right? Is there a family history? Have you had normal mammograms? How bad are your symptoms? Is it right? And so the other piece of that is we used to, before we knew better, give estrogen without progesterone. The issue really for the female body and the female organs is you should not take estrogen without taking also progesterone because you can't your tissues, your organs should not be exposed to just estrogen without the balance of progesterone along with it. That's what increases the risk of the cancers that we have known, right, for many years. But even saying that, you still have to have a good discussion about, okay, what have you tried? How bad are your symptoms? What are your risks? is the risk, we always talk about, is the risk and the benefits, what outweighs what, right? And then you make that discussion, because some women that I've talked to, they're miserable going through menopause. They're miserable. They can't sleep. They have hot flashes and night sweats, and they're irritable, and they're depressed. There's all those hormonal changes are happening. And so their quality of life has drastically declined. And so they may say, you know what, at this point, tell me what my risks are for taking it. Let me decide. There's never no risk, right? There's never no risk with anything. Tylenol, it just isn't. But you have to weigh the benefit versus the risk based on what you know and what's going on in your life. So I will tell women, don't shy away from it, but have a good discussion with your provider.
If you are just tuned into Warriors Talk, we're live on Intellectual Radio, and I'm speaking with Dr. Michelle Meeks, MD, and we're talking about hormones and her, and she's breaking down everything to do with and understanding the silent power behind women's health. So you were just talking about menopause, right? In going through my cancer journey, it put me through early menopause. I want to say because I was 43 at the time, and I was getting up until that time, I was getting my period regularly with no issues. I go through chemo. I had my last period that February, started my chemo, and then my period stopped, which my doctor, she asked me like, hey, do you want to have any more kids? Because the type of chemo we're going to give you, you're not going to be able to have any more kids. I said, no, I'm done with kids. Okay. So then my period stopped after I did the chemo. Once I was done with the treatment, the next year in February, my period came. And I was like, what is this? Then the next year in February, my period came. So it was coming every February, like once, I think until I got about 53, maybe. So it was just coming, like, I guess that's perimenopause. It was, my body was getting ready to go through it. So, and I have to say, I'm grateful because like a lot of the symptoms that women complain about, like hot flashes and all of that, like I get none of those things. So the only symptom that I know that I had was the no period from the menopause.
Right.
So.
Yeah, and that's good, because one of the first, signs that, you're in perimenopause, which is your body preparing, is that irregular period, and it could miss for months. We usually will say that if you've missed your period for 12 months, then you're in menopause, right? But if you were having a period at that 12th month, you weren't quite at menopause, you're kind of getting there. And like you said, because you can be in that perimenopausal state for years before you actually stop having a cycle, which we call, menopause.
So what are the mental health risks when it comes to menopause? Does your mental health play a role in, not menopause, I'm sorry, play a role in your hormones being unbalanced?
Yeah, so when your hormones are out of balance, yes, for sure, it can affect your mental state. And there is some thought too that it can go the other way too, right? Because if you are depressed or stressed, we know that can affect certain hormones. Like we said before, your cortisol, adrenaline, those things can affect your mood. It can affect your thyroid, which also affects your mood. So it goes both ways. But we know that when those hormones are out of balance, it certainly can affect the mental health and mental wellness. And if you're feeling, sad, irritable, really anxious, right? Those are questions your doctor should be asking you, especially for your annual checkup when we do, head to toe questions. If you're having that, sometimes we might think, oh, it's just me, I'm just going through a lot, I'm just stressed. And we tend to push it aside. But maybe there's something that we can actually medically diagnose and treat, give you some tools. We haven't talked really about the fact that, stress can affect your hormones. And we always talk about what can you do to put your hormones back in balance naturally. Part of that is yoga, meditation, stress, exercising, right? And all of that, if you're someone that doesn't want to be on medications, you've got to take that next step to be proactive about your hormonal health. What we put in our bodies, right? We know that high fiber foods, foods with omega-3 are good for our hormones and our health and our mental well-being. And so making sure you're eating, high fiber plant diet, fresh fish, the things we always talk about that affect so many things. And that's really being proactive and starting that early in your life, so that you can feel good and have a good quality of life.
What role does sugar play in your hormonal health?
Oh yeah, we didn't even talk about sugar. Sugar is very inflammatory, can affect your immune system, can, yes, for sure, put your system out of balance. We know that insulin, which is a hormone it's supposed to go to your organs and help your body to utilize the glucose, sugar in your body for energy. But if there's a lot of excess glucose, we call it just sugar, but glucose floating through your system, it can adversely affect all parts of your body, from your immune system to even, we think, having all that excess sugar affects your arthritis, your joints, because it's all very inflammatory in your system, right? And so we think sugar diabetes, but we don't think about all the other things that having that high sugar does, right? We think, okay, my sugar is up, I'm supposed to bring it down, but why am I supposed to bring it down to normal, right? Because it affects all these other parts of your body.
We hear a lot about gut health. What about gut health? What role does it play on your hormones?
Yeah. So everything that we put in our bodies goes through our gut. And if we don't have a healthy gut, then it also can cause internal stress in how we are able to digest our foods. If you're not able to digest your foods in a good, easy way, it causes your body to have to do more work to get the nutrients from your gut to be able to use it in your body to bring more balance to your system, right? And so gut health, that's another thing we really don't think about, from just something simple like having acid reflux, right? We think of it just as a simple symptom. Yeah, I have heartburn, but we know that acid reflux and that heartburn over time can lead to physical stress in your body, which can lead to even cancer, esophageal cancer, gastric cancer, right? And that's a stress to the body that then is going to affect all those hormones that we talked about. When there's gut stress, it affects your insulin and how your pancreas, we talked about your pancreas, which is part of that gut system, how that pancreas is able to release enough insulin to metabolize, break down all that sugar in your system. It all is one, as you said in the beginning, one symphony that works together. One thing affects the next thing, that next affects the next thing. And so none of it's happening in its own little system and staying there. It's not.
I'm not sure if we talked about exercise and how that play a role. Does it influence your hormonal health?
Yeah. So I like exercise. When I think about exercise for your hormonal health, hormonal balance, absolutely exercise is a positive influence on our hormones and on our hormonal balance. And I would encourage people to start in your 20s, 30s, teens, to start an exercise program. And I always say it doesn't have to be anything major, jumping around a lot. If you can't do that, I want you to start walking. If it's on a treadmill, I want you to, we know that walking in nature, being outdoors with nature, reduces the cortisol level, decreases your stress level. So I'm a big proponent of, if you've got a little track or a forest preserve near you, now that the weather here is getting a little better, go for that 30-minute walk. It's going to do wonders for your hormones and your balance. Start taking yoga, start meditating, find that exercise that you enjoy, because that as well decreases the stress and puts more balance in your hormones. When we live a sedentary life where we go to work, we come home, we sit all day, or for many people, they sit all day at work and then they either move to the couch if they're working at home, and they sit from one place to the next and we don't move around. We know that that sedentary lifestyle increases your risk of hormonal imbalance and what comes from that, obesity, because we're sitting, and then we get heart disease and all the other cascade of things that can happen. But we always talk about the power of exercise and what it can do, from just lowering your risk of so many physical diseases to lowering your risk of mental illness and improving your mental wellness.
I totally agree. Like, exercise is just one of the best medicines that you can.
Yes.
That's free. I remember I was hospitalized going through my cancer journey, and I had to get a blood transfusion. And I don't know if this was a doctor or a nurse that came in there, because I never saw this person again after I was in there. And he was just talking to me, and he's like, "Are you exercising?" I was like, "Yeah, I walk every day. Even though I was going through chemo, I would walk around this track by my house. I would just take my time and walk." He was like, "Keep exercising. Like, don't stop." And I'm like,
Right.
felt that was kind of weird, but I'm like, okay, so exercise is one of those things that I never have a hard time fitting it into my schedule. I don't need a partner. I can do it by myself. I don't need to be in a gym. I just I can use my phone. I can use my computer. Go to YouTube, look up videos. They have videos on everything that you want to do. You want to grow your glutes. You want to walk for your heart health. Like, everything is there. So we really have no excuse. And it doesn't have to be. They have 15-minute walks, 10-minute walks, 30-minute exercise. It just depends on how important it is to you to fit it into your schedule. You can exercise now, or you could be in a wheelchair later. Like, make your
Yeah. You said it. You said it. I'm trying to age gracefully and be active until the day I can't be, right? And so for me, it's walking my dog twice a day is most of the exercise that I get now, right? But I try to do at least a mile with him in the morning, and if I'm up to it, a mile in the afternoon, because we know, I mean, if anyone out there listening, the one thing you can do is get moving, start walking. Like you said, 5 minutes, 10 minutes, do whatever you can, so that you can just preserve your health and, as you age and get older.
Yes. Since I told you I went to the doctor and my pressure was high. It was like I think it was like 160 something over 90. This was back in December. And then when I talked to my doctor and say, hey, he was trying to put me on the medicine, I'm like, no, let's try to do this naturally. Let's see what I can do. If this has to do with lifestyle, let's see what I can control. So I got a blood pressure cup, and I've been taking my blood pressure. And this morning I was at 126 over, I think 65 or something like that.
Awesome.
And from that 160, and just every month it just goes down and down and down. And that comes from me. I've been walking 3 days a week. I've just been watching what I've been eating. I've been doing my hibiscus tea. I've been doing my grapefruits, and just little things like that. I've been trying to get into bed early because that plays a role on your blood.
Yeah.
So little things like that, that I'm trying to make sure that I'm controlling my controllables, so that,
Yes.
I have nobody blame when I go back to the doctor because, this is my health. And if I cannot partner with the doctor and say, okay, I'm going to do my part, you do your part, and I'm going to do my part.
Right.
And
Right. Yeah, I tell patients all the time, listen, it's easy for me to pull out a script pad and write you a prescription. I don't want to do that, right? This is about your life beyond this exam room, right? And so, what are you going to do if you really don't want to take this pill every day? Let's partner together so I can give you the tools to do it. But as you said, it's easy for us docs to tell you what to do. You got to go out there and do it. So kudos to you for being consistent with that, because we know when you're walking, especially, it lowers the adrenaline, it lowers the cortisol. Those things affect your blood pressure, right? It lowers the hormones that affect your kidneys, because the kidneys can produce its own set of hormones, which can either lower or take your pressure up. Which one do you want it to do, right? And so the walking does so much, right? We think, oh, we're walking just for weight loss. I tell folks, we're not just walking for weight loss. We're walking, for a healthy lifestyle, for a healthier body, right? Because you may or may not lose weight. Maybe you haven't lost weight, right? You may not lose weight, but beyond the weight loss, you will see other benefits, right? Like you're seeing with the blood pressure, sleeping better. We know that mild exercise, at least an hour before you're planning to go to bed, can help you sleep better, right? So that's why I recommend people go for a walk after they eat dinner, not too close to bedtime, because sometimes it'll get you jazzed up and then you can't sleep. But at least an hour before your bedtime will help you sleep better.
yes. Well, as we wrap up the show, Dr. Michelle, can you talk to the women out there that may want to understand their hormone health and when should they be talking to their doctor about it?
Yes. So, very important that we recognize that at any age of our lives, we are affected by hormones, right? We talked about teens and the early 20s, where those hormones are starting to get in their regular cycle for normal periods and such. And if you're noticing a change to that, or you're not having a regular cycle, or you're moody, or any of those things, bring that to your doctor's attention. When you go for your checkup, we start asking you a bunch of questions. We're not just asking it to ask it, but we're looking and we're hearing what you're saying so that we can understand what do we need to do to dive into this. And it's always a good time to talk to your doctor about how you're feeling, concerns about hormones, which may be different concerns when you're 20 or 30 versus when you're 40, 50, or 60, right? And you're going through that change of life. But recognize, what you're feeling, if things are different, especially for the 50 and 60-year-olds that may be in menopause, and knowing that there are options for you, that if you are interested in a natural way to put your hormones in balance, a lot of that comes from nutrition and exercise, as I always talk about. And then if you want medical management, you can also talk to your gynecologist about that. But our hormones are affecting every part of our lives and our bodies. There are over 50 hormones in our bodies that all work together to make us our unique selves. And anytime any of them are out of balance, we can feel different things, from poor sleep, moody, weight gain, irritability, all of that. So definitely have that conversation, go to your checkup, and ask your doctor, what he can do and what she can do and what you can do to feel better.
Awesome. Thank you so much, Dr. Michelle. Can you let the listeners know how to stay connected to you?
Absolutely. They can find me on Facebook at Doc Michelle. I'm available for any conversations, talks, anything like that. But they can find me on Facebook. They can also find me. I know you always tag me on your show as well.
Awesome. Thank you so much, Dr. Michelle. I appreciate you.
Thank you so much for having me.
You're welcome. I want to highlight my sponsor, you guys, Gloria Dotson with Mary Kay. She's catering to all of your beauty needs from head to toe. You can go to marykay.com/GDTSON and let her know that Warriors Talk sent you. Warriors Talk is always looking for individuals to share their journey. It doesn't necessarily have to be a cancer journey. You can inbox me at Warriors Talk, or you can email me at warriorstalk1@gmail.com. Warriors Talk will leave you with these words of wisdom. A woman's hormones are like a silent conductor, orchestrating everything from her mood to her metabolism. Understanding them isn't just science, it's self-care. Join me next Monday right here on Intellectual Radio at 6 p.m. As always, thank you for tuning in to Warriors Talk with author and founder Lady Rochelle, where we are changing lives one warrior at a time.
Thank you for listening to this week's edition of Warriors Talk with Lady Rochelle. To find out more about Warriors Talk, follow at Warriors Talk, the number 1, on all social media outlets, and Warriors Talk with Lady Rochelle on YouTube. Please join us next week and every Monday evening at 6 p.m. Central Standard Time on intellectualradio.com for Warriors Talk with Lady Rochelle, where we encourage, educate, and empower you into action.